Hello, I'm Dr. Manon Bolliger, and I wanted to read you an excerpt from my book, What Patients Don't Say If Doctors Don't Ask. So this is on aligning emotional energy to treatment. So what seems true in my practice is that if patients are aligned with their choice of treatment, they will engage their mental and emotional energy to commit to its success. Trying to suggest a treatment that is not aligned will not create the same results. So in other words, if somebody's afraid of needles and acupuncture, it may not be acupuncture that is the problem, it is their fear of needles that will limit that success or the success that they will have with their treatment. But I did a further study in my book, and I found a few very interesting studies, so I'll continue reading here. In a recent article, the authors explore the neglected connection between risk-benefit assessment and informed consent, in which the information communicated to patients can influence treatment benefits and risks. They argue that information disclosure has potentially powerful positive and negative influence on health outcomes, and then they analyze a study in which they conclude that the placebo effect was greater when the patients were positively aligned with the procedure rather than in the study in which there was uncertainty on whether or not they would get the procedure done. So this comes from Franklin et al. So this is the study. In the following study on vertebroplasty, and the relevance of patient disclosure, it was shown that patient disclosure does have an impact on result as it influences expectations. In the first study, there were no patient disclosure and the results were attributed to the placebo effect. In the second study, where there was disclosure, patients did not know whether they were receiving the treatment or were receiving a sham treatment. But there was too much uncertainty to align themselves with the positive expected results, and clinically they didn't do as well. To further illustrate the impact of information disclosure on treatment benefits, consider the widely used treatment of painful vertebral fracture known as vertebroplasty, which, just so you know, involves injecting cement into the spine with the aim of relieving pain by stabilizing the fracture. So in 2009, the New York Journal of Medicine published the results of 2 double-blinded sham-controlled trials, which demonstrated no difference in pain relief between vertebroplasty and a faked invasive intervention without injecting cement. Now you might think, well, how could this even be a study? But anyway, that's not the point I'm trying to make. Quote, in contrast, a more recent unblinded randomized trial comparing vertebroplasty to conservative medical therapy demonstrated substantial greater improvement in pain. A reasonable interpretation of these 2 sets of trial is that vertebroplasty is effective in relieving pain not as the result of injecting cement, but by virtue of the placebo response. The power of information disclosure to influence patient outcomes is borne by the fact that patients receiving vertebroplasty in the sham-controlled trials reported a substantially lower mean reduction in pain as compared with similar patients who received vertebroplasty in the open trial of this procedure. In the former, they knew as a result of the informed consent disclosure that they had a 50% chance of receiving either vertebroplasty or a fake intervention disguised as the real procedure. In their latter, they knew that they were receiving standard vertebroplasty. These results suggest that patients' expectation of benefits were diminished in the sham-controlled trials compared to the open trials, and as a result of being informed about the double-blind study design and thus being uncertain about whether they were receiving a real treatment, believed by practitioners to be beneficial, or a fake treatment provided as a controlled intervention. That is a clear case in point that often it is the commitment and alignment to what one feels is right that makes the difference, not the actual procedure, treatment, or medication taken. So if you found that interesting, there's a lot more information and research in this book, and you can order this book at www.whatpatientsdon'tsay.com. Thank you very much. Bye-bye.